On this edition of Veterans Health Watch, we'll learn about a new program, the Veterans Treatment Docket, aimed at helping those veterans facing misdemeanor charges. We'll also highlight the VA Caregiver Support Program, designed to provide services and support for those family members who are taking care of our veterans. Please join us. Welcome to Veterans Health Watch, a program sponsored by the Veterans Affairs Maryland healthcare system that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm Kenya Griffin. In October 2015, a special court docket aimed at helping veterans was launched in Baltimore City. And joining me today is one of our regular guests, Mr. Christopher Buser, the Chief of Social Work for the VA Maryland Healthcare System, to give us more details about this new opportunity for veterans. Chris, thank you so much for joining us.
Thanks for having me back.
Chris, let's start by giving our audience an explanation or a brief overview of the Veterans Court Docket.
Sure. The Veterans Treatment Docket is it's not a first of its kind in the country, but it is a first of its kind here in Maryland. And it's an opportunity for us to interact with veterans who are involved in the justice system and to give the court options where we can try and focus on rehabilitating veterans as opposed to incarcerating them.
And you said it's not new in the country, but it's new here in Baltimore. How did it come about?
Sure. So actually, we were contacted by Judge Weinstein with the District Court of Maryland here in Baltimore. She is a veteran herself and comes from a long military history. And she wanted to do something because she was seeing that there were a number of vets who were coming into the courts. And so she contacted us and our director, Dr. Adam Robinson, who of course is a veteran himself. And we got together and said, what can we do to help the veterans, who are justice involved? So what we did is we came up with an idea to work with veterans who are charged with misdemeanor offenses, so maybe possession of small amounts of drugs, disorderly conduct, things of that nature. And we, as the VA, give the judge options for treatment. So a veteran will come into the court. We actually have a social worker who sits there right alongside the judge and will offer assessments for those veterans to help them understand if there are any drug treatment programs that they would benefit from, any mental health treatment programs. So we will do an assessment and report back to the court and say, we could offer this to this particular veteran as an alternative maybe to incarceration.
And this is a great program for veterans who've given so much for our country,
yes.
And now we're helping them in their time of need, really. So what struggle might a veteran face that can lead him or her to issues with the law?
Sure. A lot of our veterans, particularly those who may have served over in combat, come back and they may have problems with things like post-traumatic stress disorder, depression or anxiety, and sometimes veterans often come back and they'll struggle with substance abuse. About 1 in 6 veterans who served in Iraq or Afghanistan may have problems with substance abuse. And those issues sometimes lead them into conflicts with the law. Again, mostly in minor offenses, misdemeanor offenses. And once they come into the court system, what we're offering is not a chance for them to, get out scot-free, but we are offering them an opportunity to address those issues that got them involved in the justice system.
That's what makes this program so great, and not to mention the collaboration with the justice system and the VA.
Yeah.
I'll get to that a little bit later, but what makes a veteran eligible for this program? You hinted at the different charges or levels of charges.
Right. So one of the things that Judge Weinstein really wanted to do was make sure that anyone who had worn the cloth of our nation had the opportunity to come to this court. What happens is when someone is initially charged, the court will actually ask the person being charged if they ever served in the military. And if they say yes, then their charge is flagged. If they are charged with a misdemeanor, then they will have the opportunity to appear before Judge Weinstein. It's entirely voluntary, so if the judge does not, or the veteran does not want to participate in it, they don't have to. They can go into the traditional court system. But if they would like to come into the system, they'll go before Judge Weinstein. They'll have that opportunity to be assessed, and the judge will explain the process to them and say, if you want to be involved, this is what we expect of you. And there's a lot that is expected of the veteran. The judge will, ask them to participate in treatment. We'll be reporting back to the judge on the status of that treatment. She has had defendants come and present to her their resumes that they've been working on so they can work towards becoming gainfully employed, talk about the different interviews that they've gone on or the different jobs that they've applied for. If they're not attending their treatment sessions or they don't follow up on job interviews, then she does have the option of finding them guilty and putting them back into a traditional justice program where they may have to serve time. So there's some incentives to them actually participating in treatment.
Right. It's not just, okay, you get off scot-free like
right,
you said.
yeah. You can't just come in and say, I'm a veteran and by virtue of having served in the military for 3 or 4 years, can I get a free pass? No, this is not a free pass. We want you to be involved. We want you to be in treatment. We want you to be bettering your lives. This is part of a treatment program. Gotcha. So if you're not going to participate, then the judge may sentence you, and then you'll have potentially some time to serve in jail.
And if you could briefly describe for me, I mentioned this is a collaborative effort. Mm-hmm. Can you talk about the other agencies or parts of the agencies that are involved in this?
Sure. So as I mentioned before, the judge wanted to make sure that anyone who had served in the military could be seen here. Unfortunately, not every veteran is eligible for health care through the VA. They may have had a bad conduct discharge or something that makes them ineligible for care with us. But we have partnered with agencies in the community to make sure that those veterans who can't be seen by the VA Maryland healthcare system can still be treated. So we have partners like Healthcare for the Homeless who are there, who provide treatment options if they can't come to us. There are also other members like the University of Baltimore. They have a law program that works just with veterans, so they'll be there. There are also community mentors that follow the veterans throughout the process and help them with putting together their resumes, helping them on job searches, making sure that they're attending their programs as they are directed to by the judge.
Well, as wonderful as this program sounds, mm-hmm. and I was there for the first docket, so mm-hmm. I know it's a great program. The veterans seem so appreciative. There are some critics out there who oppose the program. What would you say to those critics about the benefits of this program?
Yeah, I mean, the critics, say that this is a free pass. And as I explained before, it's not a free pass. Our veterans really have to work, for this. It is treatment that they have to be actively engaged in. Other programs that have been run throughout the country, we can look at their successes, and we see that there's a 98% reduction in recidivism. So folks who graduate through this program, they don't come back into the court systems. We don't see this as a revolving door kind of program. So for anyone out there who thinks it's just a free pass or that we're just putting a Band-Aid on a larger problem, no, those are definitely not the case.
And we know that this program is new, so there are veterans who are already incarcerated. Mm-hmm. But your program also works with those veterans. Tell us more about that.
Yes. So, we can't, stop everyone from going to jail. Sometimes their offenses, lead them to have to serve time. But we want to do our best to make sure that when someone is done serving their time, that they have the best chance of getting back into the community, reintegrating, joining the workforce. So we actually have 2 social workers who go out. They go to the local prisons. They interact with the veterans who are incarcerated. They help them to apply for benefits. Some of them may be eligible to apply for service connection, other pensions. They may have dependents who are on the outside who could benefit from those services. When that veteran is discharged or released from prison, then those benefits can start up and they'll have an income coming to them right away. And hopefully with having their health care in place, their benefits in place, it'll just increase the odds that they won't have to return to a life of crime.
So have you heard from any of the veterans who are I guess, no one has actually completed the process yet. right?
Not yet. Most of our veterans who are going through the program, they'll be in the program for about a year.
Okay.
We are going to track them and find out, how they're doing. Are we getting them jobs successfully? Are they, completing and staying sober? If that's the issue. So we're going to track this and see, how it turns out. We think we're going to have very similar rates to programs outside of Maryland, and be happy to come back in a year's time and give you some of that first round of data.
That was my next question. Bring you back and a veteran to see how this program is working.
Absolutely. Yeah, I think that would be a great option.
Yeah. I wish you the best, Chris. I know your staff are working really hard and working closely with the veterans to help them succeed.
Yeah, this has been a great opportunity, where we, the VA, the city of Baltimore, the judicial system, and our community partners really have come together. This is really the spirit of veteran and family-centered care.
And we are proud to get the word out about this program. People don't often hear about the collaboration that happens between the agencies. So
right, I think it's good that the community knows what's going on.
Yeah, well, thank you so much for joining us, Chris. We're going to take a short break, but when we return, we'll hear about how veterans are being assisted indirectly by working with their caregivers. So please join us.
There are numerous benefits for a veteran to enroll in the VA Maryland healthcare system. Number one, they get excellent health care. There's a great pharmaceutical service. They have specialists in all of the areas and use cutting-edge technology. And we have a very good electronic medical health record.
You can keep your current provider as well as come to the VA.
For our veterans, no matter whether they live in Central Maryland or Eastern Maryland, our clinics are conveniently located to where they live throughout Baltimore and the Eastern Shore.
The fact that there are other veterans here that I can talk to and share common experiences with.
The amount of medical attention that I received has been excellent. The VA Maryland healthcare system is your VA. It's America's VA. It's the veterans' VA.
Since I've enrolled at the VA, it has been a great decision, and I encourage every veteran to enroll. They will not regret it.
The VA Maryland healthcare system pharmacy is second to none. The copay is minimal. The wait time is as good as you would find in a civilian pharmacy. There are various ways our veterans can access pharmacy services. One is just come to the window with their prescription. Two is through a My Healthy Vet, the internet. They can get their prescription through the phone or through our consolidated mail-out pharmacy. We're very proud of our pharmacy services. We're patient-focused, and we want them to come and see us and what we can do for them.
Welcome back to Veterans Health Watch. We're now going to turn our attention to a program that's not new. It's actually approaching its 5-year mark, but it has grown and it continues to grow. It's the VA Caregiver Support Program. And this program helps veterans in a different way by providing services to the family members who care for them. And joining us to give us more details about this program are Caregiver Support Coordinators Sharon Kelly and Lizette Grisha, both licensed clinical social workers. Thank you so much for joining us.
Thank you for having us.
Sharon, could you explain to us first what the VA Comprehensive Assistance for Family Caregiver Support Program is all about?
Sure. So it is a program that focuses on the care of caregivers. We found that caregivers kind of neglect themselves, their health, and in the service of taking care of veterans. So I'm happy to be able to talk about this program that's focusing on the care of caregivers. In terms of how a family member would go about applying for the program, it is an application process, so they would have to complete an application. We have an administrative criteria as well as a clinical criteria. The administrative criteria to enroll in the program is that the veteran must have served on or after September the 11th, 2001. They must have sustained a military-related injury that is physical or psychological that warrants the need of a caregiver for 6 months or more, and they must be enrolled in the VA healthcare system, certainly.
Sharon, you talked about the administrative criteria for a veteran to be eligible for the program or what a veteran needs to do. Is there a clinical criteria that a veteran needs to meet to also be eligible for this program?
Yes, there is. I'm glad you asked that question. So, as mentioned already, that the veteran should be service-connected for a military-related injury that warrants the need of a caregiver for 6 months or more. And they're needing a caregiver in one of the following areas, and this is the clinical piece. If they need assistance with bathing, grooming, feeding, toileting, planning and organizing, because of a short-term memory impairment or delusion or hallucination. If the veteran is struggling and needs assistance in one of those areas, that's the clinical aspect of it.
Okay, that's very important for people to remember.
Yes, it is.
It's great to hear that we have this program for our unsung heroes who support the veterans. I always say that when a person serves, they don't serve alone. Their families are serving too. So Lizette, could you tell us more about what types of services are provided for the caregivers?
Absolutely. We have a whole host of services for the caregivers, supportive services. We do provide a monthly stipend that helps out with the caregiver with any financial expenses. If the caregiver does not have health insurance, we also provide that as well. If the caregiver does need mental health counseling, we do provide that to them in our VA hospital, or we will pay for it in a community clinic. Also, we have a lot of supportive services such as caregiver support group that Sharon runs on a monthly basis, so that's helpful to our caregivers. They get together with other caregivers and just discuss their situations that they may have with the veterans. We also have peer mentorship programs. We have online trainings. We just have everything that we could find to really support and keep the caregiver not stress-free, and as well as help navigate the VA system.
And we know that sometimes caregivers, as you mentioned, Sharon, get overwhelmed, so they don't have time to take care of themselves, let alone look for help.
That's right.
How do you conduct any outreach to find those caregivers to offer them assistance?
Well, in terms of being referred to the program, there's several ways that they can be referred to the program. Certainly it's through the caregiver support hotline. It's within the VA hospital staff. We often get referrals from staff. It's also through the Health Eligibility Center. So there are various ways that we get referrals for those that want to enroll in the caregiver support program.
Okay, so it's great for if you're coming with your veteran to an appointment, just ask about the services.
Oh yeah. Yeah.
And so it's been a 5-year program. How many veterans or family members, caregivers, would you say you've served in those 5 years?
Well, as you said before, it's a growing program, and we're looking to get more people on our program and get the word out about this great program. Currently, we have 166 family caregivers, and we have about 28 general caregivers, and those are for caregivers of veterans who did not serve post 9/11. Okay. So we open the program up to any caregiver of any veteran of any era. So if they need assistance, they need supportive services, we're here to help them.
Great. I'm glad to hear that it's open to other caregivers here. There's some people who've been caring for their veterans for decades now.
Absolutely, yes.
And can you remind us again why it's so important for the caregiver to get help?
Yeah. I always say it's important for the caregiver to get help to really live. And when I talk about being able to live, I mean meeting their goals that they've set for themselves, engaging in hobbies, fun activities, visiting with family, things like that they would like to do and otherwise wouldn't have time to do. So really it's important to live for them to take care of themselves. Again, they have a tendency to neglect themselves, not go to medical appointments because of time. They just don't have the time to do that. So,
yeah. And it helps the veteran that they're actually taken care of if they're in better health and are taking care of themselves. So before we close, you mentioned the ways that a person can sign up. Is there anything else you'd like to add about the program? Any word you'd like to get out there to the veteran or the caregiver about this program?
Well, in order to apply for the program, you do have to complete an application. The application can be found on our website, which is www.caregiver.va.gov. You can download the application, you can send it in, or you can hand deliver the actual application to either one of us at the Baltimore VA Hospital.
Great. Great to hear. Thank you, ladies, so much for being here. Thank you for all you do for those unsung heroes, for the caregivers of our veterans.
Thank you for having us.
Thank you.
We're going to take a short break, but when we return, we'll actually hear from a veteran and his wife who are enrolled in the VA's caregiver program. So please join us.
As a nurse, it's very important for me to see a friendly face when I come into the hospital.
On my last tour, I was a drill sergeant, training some soldiers, and had an unfortunate accident.
I really didn't think I was qualified because I didn't have a service-connected disability.
I researched because there had to be some answer somewhere. There had to be some place for combat veterans to go.
Did you know that the Department of Veterans Affairs has been recognized for offering the best medical care in the U.S.? Locally, the VA Maryland healthcare system provides a full continuum of quality care to our nation's veterans, including medical, surgical, rehabilitative, neurological, primary, mental health, and long-term care. With a dedicated, highly trained staff, the VA Maryland healthcare system is committed to serving the needs of our nation's veterans at 8 locations throughout the state. The VA Maryland healthcare system is always there to serve and honor America's veterans.
At the VA Maryland healthcare system, we're proud of our investment in technology because it's an investment in our veterans.
I was really surprised. It's a modern clinic with doctors for excellent care.
You know, there's a sense of just that camaraderie. You feel really comfortable, and it has been helpful for me.
The categories of care have been opened up so that more veterans can qualify.
I would highly recommend all veterans to at least come down here and talk with the patient representatives and see what they are entitled to.
If you or someone you know served in the armed forces, tell a vet to call 1-800-463-6295, extension 7324, to inquire about enrolling in the VA Maryland healthcare system. It's free to inquire and easy to enroll, so call now.
When I came home from my military service, I knew that I needed help, and I went to the VA and they were there for me.
The Appointment Call Center is a fast, easy, convenient way for a veteran to call in to schedule, change, or cancel an appointment.
You can reach any of us by calling 1-800-463-6295, extension 7333.
The call center is open Monday through Friday from 7:30 a.m. till 5 p.m. If you need help scheduling an appointment, call the call center because we're here to help.
Welcome back to Veterans Health Watch. We just learned about the VA Family Caregivers Program. Now joining us to give us a first-hand view of how this program benefits them is a veteran and his wife enrolled in the program, Mr. Sean Cushing and his wife, Ms. Kathy Cushing. Thank you so much for joining us today.
Thank you.
Sean, could you give us a brief description of your military service? What did you do in the military?
I was a cook. I joined in '89, got out in '97, and came back in 2007. And then I got injured in Iraq in 2009.
I know when I hear cook, and I know some people hear cook, they wonder how could an injury happen to a cook?
Right.
So, if you don't mind sharing.
No. Over there, everybody's a soldier.
Mm-hmm.
They had civilian cooks, so we would do everything else except for cook.
Okay.
So go on patrols.
Yeah. So you were everywhere. You
Yes.
served.
Oh yes.
Can you describe for us what life was like for you when you returned?
It was hard at first. I was still really alert, vigilant, didn't want to go anywhere, especially with a lot of people. Driving was a little difficult, especially the 4th of July, it was New Year's. We was downtown in Hawaii, and the echo of the fireworks, I just couldn't handle it.
Mm-hmm.
And it's just now starting to get better.
And thankfully, you're using the VA services. And,
Yes.
As a married couple, we're talking about the Caregiver Support Program. And Kathy, you're his caregiver. As a married couple, you live together, you spend a lot of time together. What was it like for you to adjust to a new role?
It was a lot of education. I had to understand what was going on with him, what he came back with, what type of ways he was reacting with certain things like the loud noises and the crowds, and understanding our kids were elementary school age at that point, how much he could handle of dealing with them and when it got to be too much, and then just his multiple appointments of every other issue.
And so you helped him manage those appointments and things like that.
Absolutely.
As a caregiver, I'm sure your plate is full.
Oh yes.
And how'd you come up, or how'd you learn about the Caregiver Support Program through the VA?
Well, I just recently left my job, but I was working at Kimbrough Hospital at Fort Meade, and we had a lot of wounded warriors that came through, and it was one of the spouses of that just in talking, she's like, hey, did you know there's a caregiver program for you, for your veteran? And we're also really grateful for Jim Wilkes over at the OIF, so Sean contacted him and we got more information and connected us with Sharon Kelly, and from there the ball went rolling.
And the OIF is the, for those who don't know, that's the Operation, no problem,
That's
Operation Iraqi Freedom, Operation Enduring Freedom Office that
Yes.
we have for veterans from that era, that war era. How has the program helped you so far as a caregiver?
It's been nice to know that I have somebody to turn to if I needed it. It hasn't been too bad, but it's nice that they come and check on me. I'll get a phone call and email, hey, how are things going? Or how's Mr. Cushing going? And the appointments. And then they'll let me know if there's any events or anything would be interested in as well.
And Sean, I know I'm a wife. Happy wife means happy life. So how's it helped you now that Kathy is getting some support?
It's good for her. It makes me feel a lot better because when I got back, you know, my role changed a lot. I wasn't there physically, you know, in some cases mentally all the time. So she would have to take on the role still as, you know, mother, father sometimes, depending on how I was feeling. And just to have, you know, those people there that she can contact if she's, you know, needs the, you know, support, or if she has any questions or anything, they help her out, which is really good because it takes some relief off of me too.
Right. I would assume that it does. Can you give me a specific example of how the program has helped you in your daily life with being a caregiver for Sean?
Gosh, there's been so many. I've had some, not really stressful, but if like confusing information on things, and I can contact Sharon and can you let me know about this program, or why couldn't he get his appointment right away at the hospital, or what other avenues do we have? And that's been an easy access for me.
And that's what I was thinking. It's just sometimes as simple as having that access.
Exactly.
Okay. So would you recommend this program to someone in a similar situation?
Absolutely. I actually openly do that to other veterans that I do meet, and I realize they're either their mom or their spouse, and I can see there's some issues like, hey, check out the VA. They do have a caregiver program to help you out too. Yeah,
you're the unsung heroes. Caregivers, thank you. Sean, is there anything else you would like to add about the program?
It's just it's a great program, and I would recommend it to you know, a lot of spouses. I know a lot of vets have the same issues. You know, they're still trying to adjust to life, coming back, but yet, you know, you're still worried about your spouse, the kids. But with the program, you know, it kind of alleviates the stress of, you know, it lets you heal.
Right.
And, you know, also gives a support to the spouse.
That's an excellent point. Just giving you that opportunity to heal.
Right.
Is great for both of you.
Right.
Well, thank you both so much for being here. Thank you for sharing with us. Thank both of you for your service.
Thank you.
So we know that our veterans don't do it alone. So thank you so much for being here with us.
Thank you.
Well, that wraps up this edition of Veterans Health Watch. If you have questions about today's show or would like to make suggestions for future topics, please call us at 1-800-949-1003, extension 5407, or visit us on Facebook or Twitter. And remember, if you are a veteran or you know a veteran who is not enrolled in VA healthcare, please visit us at one of our facilities. Visit us on our website at maryland.va.gov or follow us on Facebook and Twitter. We look forward to hearing from you. Please join us next time.
The VA Maryland healthcare system has 3 main campuses where we deliver medical care.
And also 6 outpatient clinics, which are conveniently located around central and eastern Maryland.
All these facilities provide a broad array of services
primary care, comprehensive mental health care services, audiology services, optometry services, podiatry services.
And at our main medical centers, we have a full array of medical services to offer all veterans.
Come visit us at any one of our locations. We look forward to serving you.